Good evening. Welcome to First Aid Families with Intelevation. I'm Sarah, and I hope you are well this evening. Tonight, we're going to be talking about Lyme disease and ticks, so joyous subject there. And I've got the fantastic and fascinating Kate Parker to come and join me from Horsechestnut Herbals. Now, Kate has been a practicing been practicing herbal medicines for over 14 years now, and she was drawn to herbal medicine at a young age. So it's been quite a passion for her. And so I'd like to introduce you to Kate Parker. Hello, Kate.
Hi. Thank you for having me.
Oh, you're welcome. How are you?
I am very well, thank you. I do apologize if it sounds slightly crackly my end. I think some of the signal might be out, so I do apologize in advance if I sound really stilted to people.
It's absolutely fine. Don't worry about it. Technology is always wonderful, especially at this time of evening as well. And and I know there is a delay, so I might be talking and then Kate will hear me at some point, and vice versa. So it might feel a little bit distorted, but we'll just run with it. We'll be absolutely fine.
Yeah.
Oh. Now then, Lyme disease, and I keep talking about ticks, but there's other insects that we can associate with Lyme disease as well. I get told off calling it Lyme's disease. It's not Lyme's disease, it's Lyme disease, because it's about where it was actually founded, but I'm sure we can talk about that at another time. So Lyme disease, as a parent and as a first aider, we talk about ticks, and I remember removing so many ticks, especially this summer, from my children. It's I don't know why, it just seems to be suddenly they're just coming out. And
everywhere.
Absolutely everywhere. Now, you've got young children as well, and I know you're out in the countryside, aren't you, quite a bit?
Yeah, very much so.
Yeah, so you're quite accustomed to removal of these ticks, but also I know that you have a bit of a specialism within Lyme disease, so that would be really interesting to talk about. So really, my first question is, what is it? What is Lyme disease?
Oh my goodness me. Well, very, very basically, yes, it's a complex subject, Lyme disease. Lyme very basically is an infection caused by a spirochete, which is a type of bacteria, and it gets transmitted through ticks or other vector-borne insects like horseflies, mosquitoes, anything that will carry any other sort of bacterial infection. And it gets transmitted into your bloodstream when they bite, and lo and behold, that is Lyme disease. You'll find that a lot of people refer to Lyme disease to cover not just the Borrelia infection. So there is an argument that people talk about Lyme disease should be called borreliosis, because that's what that causes the infection. But Lyme disease also is an umbrella term for the co-infections that can be also experienced and got when you are bitten by a tick.
Okay. And I didn't realize about horseflies and obviously mosquitoes. I just thought it was always to do with ticks. But maybe is that because it's more of a likelihood of a transmission, or is it just because we talk about ticks and Lyme disease?
Yeah. The emphasis was on ticks was because that was where it originated, and it was picked up because of the number of deer that came into close contact with humans, and it's the deer tick that transmits it over. So people just had this association with ticks, but as time has gone on, it has become more and more that there are other vector-borne insects that carry it. The challenge is that the bitten by a horsefly or any other insect, they are less likely to come up with the bullseye rash, which we'll come on to in a bit. They're less likely to come up with that. So it is to make that connection between your signs and symptoms and a horsefly bite.
I see. Ah, there we are.
Yeah.
So are we all at risk for Lyme? Can we all be high risk, or are there other people that are lower risk of actually getting, I suppose, ill because of a tick bite?
Fortunately, everybody is to a certain extent at risk of getting it. There is no it's not sort of for over 50s, or if you're overweight, or if you have an autoimmune condition, or if you are more likely to be female. You know, there are certain conditions that have a more sort of prevalence in a particular part of sort of society. Lyme disease sadly can be given to anyone and everyone. The big challenge with Lyme disease is that it can present itself straight away. It can sit within you, so it becomes asymptomatic. You can have the Borrelia entire life, never ever Lyme disease. It's when the Borrelia becomes active within the system, for instance. So anybody can get it at any age. Really, so sadly, actually, it's very, very broad stream. Very broad stream.
Okay. And what kind of symptoms? Because I know a lot of people, we talk about this bullseye rash. So you've got the very red center and then the red on the outside, you know, and flu-like symptoms. But what other symptoms could people be carrying?
So the symptoms, so with regards to the acute, so Lyme disease can present both in an acute. There is also post-Lyme disease and chronic Lyme disease. The latter stages, there is a bit of discussion about what people term those sort of conditions. So from a first aid and an acute perspective, are looking at flu-like symptoms, looking at an infection that's just hit your body, and most bacterial infections produce with those flu-like symptoms. The bullseye rash doesn't always come up straight away. It can take 2 to 3 days for that rash to appear. And it is a very clear rash. If you get it, you have Lyme disease. That is the most defining symptom for Lyme disease. If you see that, you get to the doctors ASAP and you push, get antibiotics. It's really important. Most doctors on the whole tend to recognize that one symptom. Yeah. Sadly, only 30% of people will present with that bullseye rash. So they might just find themselves feeling a bit fluey. Yeah, they might just find themselves feeling fluey for about a week, and then they recover. And then about 3 weeks later, they suddenly feel really, really tired, or they might suddenly develop joint pain or an unremitting headache that just doesn't stop. Their sleep could suddenly become fractured. They could get suddenly sort of flare up, basically. Most of it can be neurological. So all of a sudden, they might find themselves feeling really, really low. And you only need one of those symptoms. It only needs to be one symptom, and it could be Lyme disease. So this is where it then becomes really quite complex and really quite difficult for the medical profession to identify, treat, and then recognize. It does help if people know they've been in a tick infested area, or there's a high tick risk area. That's often quite useful, because what you find is you'll find most of the flies and mosquitoes and horseflies around areas where you get ticks. So your woodlands, your long grasses and things like that. So even if it isn't a tick bite, you've still been in an area that would most likely have things like ticks in them. And then when you're looking at, so you've got your acute stage, your more long-term stage, there's 2 ways that can develop. So you can have long-term chronic Lyme if the antibiotics haven't been in fast enough. People can become seriously ill with Lyme disease very, very fast. So they can show symptoms very, very fast. And when I'm talking fast, I'm talking a week. So you can go from tick bite to having quite severe neurological symptoms really quickly. Wow. Other people can be asymptomatic and then come through. And then, like I say, people have the flu and then it dies down. If you're looking more long term, that's when people end up going backwards and forwards to the GP. They go and see this consultant, that specialist, this specialist. And it's that's when it becomes systemic, and you get a lot of misdiagnoses, because one of the things about Lyme disease is that it seems to have taken over the role of syphilis in being the great imitator. So you can present with, you can present with arthritis. You could present with something called postural tachycardia syndrome, which is where you feel incredibly dizzy, and your sense of balance goes out, in a very, very sort of quick way of describing that. You can develop, rheumatologists will get involved. You'll get you'll see neurologists, and they will think, oh, you get given this label. So things like multiple sclerosis, Parkinson's, ME, the list is as long as your arm, that actually could have its root cause in the Borrelia infection.
Gosh, and if you haven't recognized it, it's massive, isn't it? If you haven't recognized you've been bitten by a tick or an insect, and it was, I don't know, a couple of years ago, you might not even recall that. So therefore you probably won't even mention it. So they would have to go through this whole list, so it's such an investigation, isn't it?
Absolutely. Yeah, very much so. And it is, this is the challenge that most of the medical professionals have, particularly, where they've only got 10, 15 minutes in an appointment.
Yes,
it's very difficult. And that's not easy for the medical profession. That's no discredit to them in that respect. It is very, very difficult for that one. And then the other real big challenge when it comes to diagnosing Lyme disease, even in the acute stages. So we're talking again, back into the whole first aid, the immediate reaction is first we need to get a doctor, a GP who of Lyme disease, or B, actually recognizes is a condition and needs to be picked up very quickly. But then unfortunately the tests that they do, the first one they do is called an ELISA test. And the second one they do, if that comes up positive, they do a Western blot test. And both of those tests are very, very narrow. There is a really strange window for them to be taken. So you may not be producing enough antibodies to be showing an infection. So some people simply don't produce enough antibodies. They may have a severe infection, but they don't produce enough antibodies. So the test comes back negative. So the doctor goes, right, test is negative. No, you haven't got it.
But still could be. Yeah, absolutely.
But still could be. Or they may have started a course of antibiotics. And with antibiotics, sometimes, and again, this is where it is so subjective and such individualized condition. In some subjects, when you start taking antibiotics, the bacterium become very, very suppressed. And so therefore they don't show up. So there's, again, nothing to show up on the blood test. So that then you're showing up that, no, you haven't got it. But then you stop the antibiotics and then the symptoms bounce back up. And at which point, again, the tests show that you've got it, because by that point you've moved far enough on into the condition and the bacterium have developed cysts, etc. So yeah. It's difficult.
I bet you could talk for hours on this subject.
I could. I'm really sorry. You're going to have to stop me.
No, not at all. It's so interesting.
Yeah. I mean, the other thing, just to know, you're talking about what signs and symptoms to look for is, like I mentioned earlier, right at the beginning, with the there are co-infections that occur alongside Lyme disease. And most often you will see people with one or both of these along with other co-infections. But one of them is babesiosis and the other one is Bartonelliosis.
Nice names.
I know, they're delightful. Babesiosis is a parasite. So Babesia is a parasite and Bartonella is another bacterium. And one of the things to really look out for, if you haven't had a rash, you haven't had anything, but you suddenly notice that some of your symptoms are cyclical. So every 4 weeks they'll come back, or every 4 weeks, and you'll develop a new one randomly out of nowhere, and you'll think, why on earth, I haven't felt this before. Why? And then it'll go. You can do whatever you like for it using conventional medicines over the counter, giving it a go, and nothing really, really works. And then 4 weeks later, that goes and another symptom rolls up. Now that is Bartonella revolving. It's always worse, and same with the Borrelia, always worse at full moon, because that brings out the bacterium. So all your symptoms can often get highlighted. So people often feel worse around the full moon. So again, if just these things, it's like, okay. And you hopefully go and speak to a Lyme literate doctor and they'll pick up on those co-infections. So you're looking at things like anxiety, pain moving around the body. So you don't always have finger pain. So it goes from fingers to elbows, to your knees, to your hips, to your shoulders. And it's like, well, I wish it would just stay still. You can get rage, you can get severe headaches, you can get gut disturbances, you can get scratch marks on your body that either look like welts or just massive stretch marks.
Right.
And you can get, that is your cat scratch. So Bartonella is originally actually a cat infection. You get it from cat scratches. And that also can be found. So you may not show signs of Borrelia, but you may show signs of the co-infections.
Yeah. Oh my goodness. And there's so many things that we can say about going in the cycle of the moon as well. Just to add to it. Oh my goodness.
It's when you get into it from an observation and a learning process, these microorganisms are fascinating. And I know this condition, and there are people who really struggle with their health, and I'm not trying to make light of that at all. That really does need to be acknowledged, that these people are often severely ill, and they've often got a bit of trauma because they are being pushed from pillar to post, and they've been giving antidepressants when they don't need it and things like that. So that's when you look into this subject, it is huge and it's fascinating, and there's all these little things that start to come out, and you then start to connect to the moons, like I was saying, you connect to the seasons, and you then start to see that they are part and parcel of the environment that we live in. And then it just helps you pay attention to your environment as well, which is always a good thing.
Absolutely it is. Oh well, thank you. I just need to ask about tick removal, because obviously we've had a good intro into Lyme disease here, but if we get a tick, well, actually, let's go with this first. If we do get a tick, what is the best action? What's the best course of action to remove these lovely little creatures?
So in the UK, the action that is advised most is to use a tick twister. Yes. So you can get these tick twisters. They are, online. You can get them from the vet surgery. The vets are actually more clued up about Lyme disease than human doctors. And the best way is to do it gently. Try not to disturb them. You don't want to squash them. You don't want to tilt them. You don't want to agitate them, simply because any of that sort of action will cause them to disgorge their stomach contents, which is where these infections sit, these bacterium and the parasites sit, and that's what they will push into your bloodstream. So it's about using a tick twister. Now you can also get cards. So when you've got a nymph, so the other thing, of course, is that the size of the tick can vary depending on where it is in its life cycle. And these nymphs, as small as a poppy seed, and that can also give you, that sort of size can still transmit these infections. So you can get cards. Sorry, my hand's on the wrong part of the screen. You can get cards that are about this big, and they have a little slice sort of like cut in them, and they're small enough to get in for these little nymphs and pulling them out. In America, they don't do tick tweezers. They don't use tick twisters. They use tweezers, but they have to be very, very fine ones, not those nice ones that we all use for eyes and all sorts of things. Exactly. Or splinters. They have to be the really, really fine ones to pull out. If the mouth parts get in, that's okay. That isn't going to transmit the infection.
Okay, good.
So sometimes they get so embedded that it is an absolute nightmare to get out. If you are struggling to get the whole tick out, including the head, then it is worth going to A&E. It sounds really strange to say to go to an A&E, but go to A&E because, particularly with a child, where it becomes painful to dig this embedded, engorged tick out, and it's not comfortable, it's not nice. Go to A&E. They usually have the tool they have the knack to get these things out, whether they have Lyme disease or not, but they usually have the technique. The thing that is really, really, really important about removal of ticks is don't burn them, don't freeze them, don't suffocate them. So a lot of people talk about putting Vaseline on them. A lot of people talk about putting there's a big thing last year, I think, that went around, use peppermint essential oil. Don't, because what you do is you suffocate them and they basically go, and when they go, like that, it all goes splurging out of their stomach into your bloodstream.
Right.
So you have a dead tick, and easy to remove, but the stomach contents are in your bloodstream.
Yeah.
So it's really important not to. It is worth people knowing that you can get your ticks tested for Borrelia.
Ooh.
So if you keep your tick, the company is called, it's called Pyramid.
Oh, okay.
Pyramid Travel Products. And they have a tick testing kit.
Oh.
And you can get that, and that's quite useful. So if you feel concerned and you don't want to take preventative or prophylactic antibiotics, then getting the tick tested might be an alternative way of finding whether or not that tick carried Borrelia, because not all ticks, not all vector-borne insects will carry Borrelia, which is also adds to the confusion as to do you or don't you go out for a walk in the woods.
Yeah, yes, no, please go out because it's good for you. But is there anything we can sort of is there anything we can sort of like prevent tick bites? Is there anything we can spray on ourselves or use?
Yeah, there's the basic things like putting your trousers into your socks, long sleeve tops, making sure you are covered up. When you get home, check everybody. Get in there, check everybody. There are a few tick repellents out there. It depends on whether you are looking for the more chemical or the more natural way of doing things. Really, really powerful chemicals are out there, and they are sufficient, but they do come with their own side effects too.
Sure.
With regards to respiratory challenges, skin actions. But some people prefer those. So those who have had Lyme disease, been through it, come out the other side, they go, I'd rather have that than go through what I did.
Yeah, I understand that.
Equally, absolutely. Equally, things like there's a product called Mozzie that Lyme Disease UK, which is the leading UK charity for Lyme disease and promoting Lyme disease. Really good. So if people want more information on there, they have a fantastic website, and it is designed to educate and give people information. I have to say, I make a tick and insect repellent. I spent a year researching the essential oils for it, because you can do lots of essential oils that help prevent ticks, or insects rather, but I wanted to know what actually prevented ticks, because that often people have an association with ticks. So you can create an insect repellent for horseflies, but to create an insect repellent that actually can repel ticks is because of quite a them. So I spent a year researching different essential oils and different combinations. So I've got a tick and insect repellent spray bottle that I use, and I use it on my dogs. I decided to trial my dogs for it, and bless their hearts. I trialed it on my children, trialed it on my husband. I was like, right, you know what? I've got this perfect test. We walk in woods, we are surrounded by deer, we're surrounded by long grass. We have every single possible opening opportunity for these things, and it does work, and it was effective. So it does work. I know how effective it is. So those are the best things that you can do, and really, really important. Don't panic about it. Go out there, go out and enjoy the countryside. It is not worth developing a fear. Do not develop a fear for going outside in case you get this, because there are things that you can get in. You can look after yourself to reduce the getting it. So it's things like making sure that you go out when you're in a trying to sort of keep yourself calm, having looking after yourself, making sure your diet's well, see if you can get a work-life balance, which sometimes gets tilted in the wrong ways, but as long as you find ways of rebalancing it, then that's all to the better. And it's those sorts of things that then enable you. And then when you come back from being outside, again, making sure that so the follow-up to that would then be making sure, again, keeping your diet well, you're outside doing some exercise. And then if you are concerned, then some of the herbs that are really useful right at this moment in time are things like thyme, things like rosemary, things like mint. So the Labiate family, they're really good herbs to start having drink of cups of tea of those, in the week or so after coming. And that just starts to support the body, getting it, and if you do find yourself needing to have antibiotics, then those herbs help to increase the efficacy of the antibiotics as well. So at which point you're already doing good stuff for your body, already helping the antibiotics come in, and you're in a monster to then sort of prevent the Lyme disease coming through.
It's great, isn't it? And it all comes back down to your health, doesn't it? It comes back to what you eat, what you put into your body, how your lifestyle is, and stress, can exacerbate, so many of these problems, so absolutely great advice for that. Thank you. And
you're welcome. And Lyme disease very much is a condition that highlights to individuals where their balance is out of sync, or where their life is out of balance, rather. It really is. And that's a tough question for a lot of people. That is a tough question. It's not easy to answer. So, if you think you're feeling concerned, well, then have a look at your life and see what you can do as a preventative in that respect.
No, absolutely. So right. You're so right. And I know, because I use this, Kate's got her very own tick removal kit and all the herbs and everything that go to support removal of that tick, things that you can put on after. And I'll put it in the link underneath the underneath this live, so anyone that's watching on, I don't know what to call it on this live, so anyone that plays it back can actually have a look at the link. It might be worth putting in the pyramid link as well for that, and definitely a link to you, Kate, because at the end of the day, absolutely fascinating subject, and I love all this herbal medicine and things that we can actually do, that's in our garden that can actually help support, our immune systems and make life a bit easier for ourselves. So absolutely wonderful.
Definitely.
Oh, well, thank you so much. I think we've covered quite a bit this evening anyway.
Yep.
I know it is a massive subject. I appreciate that. So it was really quite difficult for you to be able to bring it into, I know we've been nearly going for half an hour, but that's fine, to bring that down into just a half an hour session there. But absolutely wonderful. And
my pleasure.
And I look forward to catching up with you at another time. But thank you very much.
Definitely.
Again.
And you're welcome. And I do say that if anybody has any questions or any concerns, I am more than happy to answer questions. If you drop me a PM, my details are all there. I am more than happy to just simply to take out the element of fear and worry. It's important that people know that there is somebody there that they got it. So please get in touch. More than happy.
Oh, wonderful. Well, thank you very much. And
you're very welcome.
And I will see you at some point, hopefully, face to face, maybe.
Fingers crossed.
Fingers crossed. Thank you very much.
You're welcome.
Good night,
Take
everyone.
Care.
Bye-bye.
Bye.